Forging ahead, chapped lips and all, it's the Medicare for the Lazy Man podcast. A podcast that folds up like a cheap suit. He gets the wintertime blues every winter. It's Medicare expert Doug Jones.
Hello again, everybody. Welcome to another thrill-packed episode of the Medicare for the Lazy Man podcast. It is a wonderful day here in Arizona. It is wintertime, and it's going to be in the 70s today. So suck on that, people, you northerners that are freezing your buns off. In any event, I am Doug Jones. You may have heard that announced at the beginning of the episode, and I'm here to help you feel really, really confident about Medicare. It's one of these things that happens in life like puberty that changes everything, and I believe it has the capacity to improve your life significantly, especially considering the political turmoil surrounding Obamacare for a lot of people that are younger than age 65. I believe that you're going to find that Medicare is a breath of fresh air. And the process of getting into Medicare is very simple when you ask me to guide you in that direction. I would say more simple than you would ever expect it to be, because I have nothing but thousands of thank yous from people that have said, "Oh, you really made this process a lot less unpleasant than I thought it was going to be." So I think at least you won't hate the process, and you'll come out the other side with superior medical coverage that will not cost you very much money, will last you the rest of your life, and will keep you from the danger of medical bankruptcy. So in any event, how do I convey all of this beautiful information to you? Well, I start by writing a book and putting it on sale at Amazon or BarnesandNoble.com. The name of the book is Medicare for the Lazy Man. Until recently, the best option for you is Medicare for the Lazy Man 2025. But last night at about 11:30 at night, I sent the files off to my lady who compiles them and who massages them and who turns them into a rather attractive book. And the Medicare for the Lazy Man 2026 is on its way to becoming a full-fledged book on sale at Amazon. I don't know when this episode is going to be played, but it probably won't be on Amazon yet. But get ready, get your dialing fingers ready to go to Amazon and search Medicare for the Lazy Man 2026. That'll be on sale almost before we know it. And it will be the guide that gets you into the world of Medicare when you're ready to go. And there are certain things about getting into Medicare that I cannot help you with as your agent. I must guide you as to how to sign up for Medicare Parts A and B. And, there are different ways of doing that, and some of them are easy, some of them are a little more complicated. But once you have Medicare Parts A and B, I can do everything else for you. You don't have to do a darn thing. You just have to answer a bunch of questions and respond when I send you an email. And frankly, your part of the process is going to be very easy and very quick. So remember that. Medicare for the Lazy Man 2025 if you want the current one, which is a very good book and will do the job for you. 2026 if you want the brand shiny new one with that new book smell that's going to be coming out before Christmas. I'm pretty sure. I'm hoping before Christmas. Now, there are two other books that are available that I've written that should help you in your quest for Medicare if you want to get deeper into the process. One of those books is Medicare Drug Plans, a do-it-yourself guide. Now, this book helps you figure out how to use the government website to select the very best drug plan for you. And the instructions are evergreen, as they say. So you'd be able to use this book next year. You're going to have to do this process once a year because there's a lot of turmoil in the drug plan arena. And so I would suggest that you purchase my book. Give it a try. It's a simple step-by-step tutorial that will show you how to obtain the best drug plan that is available for you. And you can do that on the government website. That book is, I think, $4.60 for the Kindle version, but I think the paperback is going to be easier to read, and that's a $10 item. I don't make a dime on that book. I just want people to learn how to select their own best drug plans without having to breathe down their necks and without having other annoying insurance agents do the same thing to them. And finally, the book that's going to be very helpful for people who want to know how to sign up for Medicare. What do I do? I get that question all the time. Okay, I've decided I want to buy this Medicare supplement from you. I want to buy a drug plan from you. What do I do next? Well, I wrote a very, very short book to tell people what to do next. I named it a name that nobody seems to understand. It was kind of an inside joke between me and this lady who helps me with my files every time I write a book. And it didn't work out that well. So I've asked her to create a new cover for me that will be a little more explanatory. It's going to be called Medicare for the Lazy Man Enrollment Guide. And it's a real short, a real inexpensive book that you can get at Amazon. And it's going to show you how to enroll in Medicare Parts A and B, and then tell you about the process that you and I are going to use to select your drug plan and your Medicare supplement, the supplement being the most urgent part of the thing. So those are the items that you can purchase to help you along your route to Medicare. And frankly, I'm just happy to be here to encourage you in that direction. It just as Randy Carson encourages me to get up every Tuesday and Thursday morning to do another podcast episode. I'd rather sleep in, and especially considering the fact that the book is now in somebody else's hands and I can relax a little bit. Randy doesn't seem to understand that. He's a slave driver. So let's say hello to Randy Carson and see what he's got in store for me today. Hello, Randy Carson.
Hello, Randy Carson. Yes, that's
Yes.
me.
Let's all say hello to Randy Carson.
How you doing, Doug?
Well, I was doing, not that well. I wasn't that perky. I was kind of sleepy, but you perked me up right away with your story about your next door neighbor, and you withheld enough details that I'm going to be asking for more when we have an opportunity to share a few Guinea together.
Well, we will. We are definitely going to do that because
You want to give the audience a taste of what we
yeah,
discussed?
well, our next door neighbors are really, really adventurous sort of folks, and they are right now in the early stages of a trip to the Antarctic.
Ooh.
They're going to go down there and visit penguins and leopard seals and anything else they can find. So I wouldn't want to be there because bottom line is those of you who are, familiar with the geography of the world, to get to the Antarctic, first of all, you have to get to the southern tip of where do we want to go?
Tierra del Fuego.
Tierra del Fuego. We want to get, yes, down there, Argentina. And then bottom line from there, they put you on a ship and wish you well to make sure, see if you can get across the Drake's Passage without sinking.
And then they wave goodbye. They're not going with you, right?
Right. So, and even though this is the summertime, people, the waves in the Drake's Passage they run anywhere between 30 and 60 feet.
Boy, I wonder how Drake managed to do it. I read a lot of stories about sailing ships, and as an Anglophile about the days of the British Empire. And they would sit there and go, it's a shortcut to India. Let's go underneath South America. And
Right.
after about 3 weeks of fighting a headwind, that's where the business school.
Headwinds. Oh, geez. Everybody has had a headwind throughout their life.
A lot of these ships just gave up and said, okay, we're going to turn around and go the other direction.
We're not getting it. We've been paddling for straight 6 days and we haven't moved an inch.
So they gave up and went around the long way. And of course, people at home are going, where the hell? They're supposed to be back by now. And it was never a sure thing when you set out on a sailing ship back in those days.
No. And when I was talking to my neighbors and while they were preparing to go, I said, "Well, watch out for the polar bears." And they said, "There's no polar bears in the Antarctic." And I said, Well, okay, nothing to be worried about then. He goes, oh, no, that's not true. There's
Uh,
another thing called a leopard seal that looks like, a gigantic seal from hell and teeth to go with it.
and I would imagine they're always hungry.
Oh, they are. They're hanging outside, on the, in the water, just waiting
Yeah.
for somebody to fall off the ice shelf and go, "Hey,
Oh
buddy,
boy.
it's lunch."
Oh man. Well, I can't wait to hear what happens because you told me that when they come back, there's going to be story time aplenty.
Yes, story time aplenty. I'm wishing them well because obviously they've been waiting to do this their entire life. It's been a bucket item. One of my bucket items is very similar. It's to stay away from the Antarctic.
Me too. I don't want to go any place that it's colder than right here, right now.
Well, you told me earlier as we were preparing for this podcast, you say, "Oh, if I want to go, sit out in the side and, freeze my buns off, I'll just go to Chicago."
Exactly. That's close enough to Antarctica for me. And there are enough people that resemble the evil what are the
Leopard
tigers?
seals?
Leopard seals that
Yeah.
I don't need any new wildlife to get to know it.
No, the only advantage would be is if it were truly a leopard seal on the sidewalk, you could more than likely outrun it because they've got no feet.
Well, that's not true of some of the people that hang around in Chicago. So I'm quite happy here. This Arizona is a beautiful place, and I'm quite happy not dealing with those kinds of dangers. But I'm also going to be very happy to listen to the stories when you manage to collect them
Oh,
from your neighbors.
yeah, I'm really looking forward to it. Now, obviously, I wish them well because bottom line is I don't that takes a certain amount of
Moxie.
moxie. That's a great term to go down and do that. And bottom line is I wish them all the best, and I can't wait to hear the stories.
Well, I
But on the
can't wait.
other hand, they've got no cell service. They've got nothing. All they can do is tell, unless they have some sort of a camera that doesn't, like not a cell phone because there's no cell service.
Yeah.
So I don't know what they're going to take pictures with. Maybe they're going to hop up on the snowbank and paint. I don't know. But
Oh boy, oh boy, oh boy. Well, we'll find out, I guess, if they make it back alive.
yes, yes, we will. Definitely. Well, I'm going to go ahead and mute out
Yeah.
because one
You've
of
given
my
me too much to think about now. My brain is spinning around.
one of my side jobs is the nominal producer of this show. So
That's
we
right.
need to
So,
make some money because guess what's coming soon?
Christmas.
We get to spend all of our advertising income on a hamburger.
For some reason, 2 years ago, I was able to find out we had a balance of $140 in the advertising account. I don't know how
Yeah.
to find that account. I don't know if it even exists anymore. So
Well, you know what
maybe
I'm going to
somebody,
tell? I'm going to say, hey, I found it, Doug. We've got $400 in there.
well, that would be good news. That would be excellent news.
No,
So,
my point would be is we could get better steaks.
oh yeah, well, I'm not a cheapo when it comes to steaks, but
I know you're not. All right, I'm going to
okay,
go ahead and mute out and let Doug do his job. I hope
yeah.
everybody has a great day, even though I'm in Arizona freezing weather.
Well, Arizona freezing, meaning it's what 60 degrees now,
It's 67, heading for 70.
67. Yeah, I heard 73.
Well, maybe in your neck of the woods,
And I'm up on the nosebleed mountain.
you are.
All righty. Well, let me read a Medicare Advantage Minute selection that I ran across. The content curator worked on this and it had about a page and a half highlighted. And I gave it back to her and I said, I know that you're having trouble with cataracts and glaucoma and all that stuff, but did you mean to quit before you really got started in evaluating this article? And she said, I don't know what I meant to do. And it came back to me later this morning. And frankly, I don't know. She didn't seem enthusiastic about it. So if I have to quit this thing in the middle, it's going to be because nobody wants to hear anymore. The headline of the article is Why Medicare Advantage Contract Negotiations Are Getting Heated. And I thought, boy, everybody loves a good article, so let's find out what this is all about. There's simply more at stake in these negotiations for payors, that's insurance companies, and providers, that's doctors, than there used to be, one expert said. Payers and providers are increasingly butting heads over Medicare Advantage contracts, with some health systems opting to go out of network. For years, providers have demanded higher reimbursements to address workforce shortages, rising labor costs, and increasing administrative expenses. Now, due in part to the pandemic, the panic-induced inflation, some providers have reached a breaking point, leading them to sever ties with specific plans. Provider challenges in delivering patient care amidst onerous payer coverage barriers or insurer refusals to contract with providers unless they accept below-cost reimbursement rates. And we go to page 2. Or business terms that interfere with efficient care delivery may lead providers to make the difficult decision not to participate in a particular network. Payers, meanwhile, are refusing to foot the bill as they face higher costs for drugs, procedures, and overall care delivery. Other factors, such as growing Medicare Advantage enrollment and a gradual decline in patients covered by employer-sponsored insurance, have intensified the pressure. So it says Medicare contract disputes are on the rise. Prices soar as Medicare Advantage grows. Payers and providers ink multi-year contracts on payment rates. However, a spike in inflation after 2020 caught both sides off guard, squeezing their margins. Health systems are attempting to recoup the money they lost over the past few years, with many arguing that reimbursement has fallen further and further behind costs. Providers have argued that Medicare Advantage plans contribute to their shrinking margins despite federal research showing little to no impact on profits. Insurers, meanwhile, are struggling to maintain profitability because they underestimated the cost of deferred care and other expenses. That deferred care means that people that were hiding out at home because of the panic, the COVID panic, put off their planned voluntary medical procedures until things settled down, and then the hospitals are now besieged with a bunch of people who had put off not necessary, or I said voluntary, there's a better term for that, for medical procedures that they could postpone until conditions were better. And that's what's happening now. All these people are lined up outside hospital doors demanding treatment for conditions that they had not had, they postponed the treatment for. So payers, insurance companies, are asking themselves really tough questions around whether or not Medicare Advantage will continue to be a profitable line of business. We continue to see plans exiting marketplaces. In the meantime, insurers are turning to cost management strategies such as prior authorizations, everybody loves that, don't they, to limit expenditures, drawing the ire of patients and providers and politicians alike. Enrollment in Medicare Advantage has risen steadily for 2 decades, with more than half of eligible beneficiaries enrolled in Medicare Advantage since 2023. At the same time, the U.S. population is aging rapidly. From 2020 to 2024, the number of adults age 65 and older grew by 13%, significantly outpacing the 1.4% growth of working age adults. Those would be age 18 to 64, while the number of children declined by 1.7%. Coupled together, these trends are spurring further growth in the percentage of patients covered by Medicare Advantage and traditional Medicare, and a gradual decline in the number of commercially insured patients. That's causing consternation among providers who worry that patients with employer-sponsored coverage will age into Medicare Advantage plans with lower reimbursements. Contentious negotiations will continue. That's because Medicare Advantage plans are not required to pay more than what a provider would have been paid under traditional Medicare for out-of-network services. It essentially caps how much they're paying out-of-network, and that out-of-network cap really influences the negotiations around whether the provider becomes an in-network provider. In addition, growing provider consolidation driven by hospital mergers and acquisitions means that large health systems have more negotiating power than individual hospitals. Now, some health systems are flexing their muscles. Mayo Clinic, for example, announced in October that it would no longer accept patients covered by certain Medicare Advantage plans, including some provided by Humana and United Healthcare. Other systems like Johns Hopkins, Allina Health, and Essentia Health have also dropped plans. The so-called big, beautiful bill will reduce federal Medicaid spending by almost $1 trillion over a decade and increase the number of uninsured individuals by 10 million, according to the Congressional Budget Office. Is that true? I don't believe it. I do not believe it. An increase in the uninsurance rate would hit hospitals as uncompensated care costs rise. So finally, there are many reasons why negotiations between providers and Medicare Advantage plans have become more contentious, but the bottom line is there's simply more at stake in these negotiations for payers, insurance companies, and providers, doctors, than there used to be. So the the confusion goes on, and we are going to have to sit back and eat popcorn and watch for the fallout, see where things land. Frankly, with Medicare Advantage plans not doing well, I think a lot of that problem is going to land right in the laps of the patients who don't have the coverage that they hoped they were getting. And that's going to be a big disappointment. I warn people, stay away from Medicare Advantage plans if you can possibly avoid them. And in fact, I've got very, very good friends in Illinois who were neighbors, high school friends. The husband and I were high school friends. Later, we lived on the same dead end road and raised our kids together and got to be good friends. And now they've moved to a beautiful place on a lake, and I have moved to a warmer place. And last night, Mrs. of the Marlene, Mrs. Of the family, sent me a text, which was a series of interactions on next door, I guess it was, at one of those things where a lot of morons get together and spout off their opinions. And it started out with somebody saying, all things under Medicare are going to be subject to prior authorization starting January 1st. And then, of course, the people that kind of knew more about what was going on criticized and corrected him. And then there were other people who, posited incorrect guesses as to what was going to happen. And so I thought, boy, all these people are very confused. And Marlene wound it up by saying, I really enjoyed reading this because many of these people said exactly what you say in your books about Medicare Advantage being kind of a dangerous way to go for people who want coverage in case something bad happens to them. And so that made me think, well, I should be more responsible with my friends. So what I did was I asked AI for a list of the items that are going to be subject during this 5-year test of prior authorization under original Medicare, which didn't used to have any authorization at all, except for just a couple of things that were full of people who are scamming the system. So they instituted prior authorization for just a few things. I think it's like facelifts and stuff. So here's a list of things covered by this trial prior authorization test that's going to go on for 5 years starting January 1st. Electrical nerve stimulators, sacral nerve stimulation for urinary incontinence. Who knew there was such a thing? Phrenic nerve stimulator implantation, deep brain stimulation for essential tremor and Parkinson's disease, vagus nerve stimulation, induced lesions of nerve tracts, hypoglossal nerve stimulation. So far, I'm seeing a lot of nerve stimulation procedures.
Seems to be a lot of stimulation going on here.
Yeah, I wish I were more stimulated. This list is getting pretty boring. I wonder if we have any listeners left. They've all fast forwarded to the next segment. Epidural steroid injections for pain management, percutaneous vertebral augmentation for vertebral compression fractures, cervical spinal fusion procedures, arthroscopic lavage and arthroscopic debridement of the osteoarthritic knee. Sounds like what my godfather invented back in I think it was in the 60s. He invented arthroscopic knee surgery, and he put Gail Sayers back on the playing field for a few years after his days were over. He was able to go out and play again. Percutaneous image-guided lumbar decompression for lumbar spinal stenosis. Skin and tissue substitutes. This would be application of bioengineered skin substitutes, like for chronic non-healing lower extremity wounds. I guess it'd be like people who have poor circulation. incontinence control devices for urinary incontinence, diagnosis and treatment of procedures for impotence, uh, and prostheses and other covered treatments. So that's the list as AI presented it to me today. So it's not like there's a lot of stuff that people have on a daily basis. So it may be that they will give up or just retain this limited portion. But what I'm worried about is that original Medicare is going to be subject to prior authorization for more and more things. And it's going to creep into that managed care territory that we have now with Medicare Advantage plans. The fact that they are managed care is one of the reasons that I warn people away. Don't go there because, like I say in my book, my new book, as well as the older book, they're like the roach motels of health insurance for Medicare. You can check in, but you may not be able to check out of a Medicare Advantage plan. And I've had plenty of people I've had to break the news to. I'm sorry, but your physical condition does not permit you to qualify for a Medicare supplement plan, so you can't go back to regular Medicare without taking a huge financial risk. All righty. So the next segment we'd like to do every episode is Your Medicare Benefits 2025, and we're up to the T's now. Everything's alphabetical in this big giant book. So a couple of nights ago, I opened it up and I marked the parts that I wanted to read. It's like a family Bible, only without all the good news about many births that have occurred and additions to the family. The subject today is traction equipment. Now, we're not talking about farming. We're not talking about plowing a field. Part B of Medicare covers traction equipment as durable medical equipment that your doctor or other healthcare provider, they always throw that in, and I always forget to ignore that little phrase, your other healthcare provider, prescribes for use in your home. That's the important thing here, use in your home. For more information, go to medicare.gov/medical-equipment-suppliers or go to medicare.gov/coverage/traction-equipment. And that's going to be it for your Medicare Benefits 2025. Now, I've got a whole pile of stuff here. It's like house cleaning day, only I know we're not going to get through much of the information, but I like to share my correspondence with some of my favorite clients or clients that are going to be. And in fact, this morning I got a message from Cal. Now, Cal lives in Nebraska, and I told Randy about my difficulties dealing with the state of Nebraska Insurance Department. The licensing requirements are different than any other state I've encountered, and the company that I'm dealing with that Cal wants to get a Medicare supplement from is new to me. So I want to learn their processes, and I told Cal, all right, this is going to be like an adventure. It's going to be a learning experience. But I had told him he has to be patient. Well, Cal is the wrong guy to ask to be patient because he contacted me over a year ago and started asking me questions about Medicare. He is not patient, and he wants to get everything done way ahead of time so that he can rest easy that everything is set and ready to go. So he's a little nervous. And this morning, what I told him the other day was my corporation now has the required Nebraska license. The company in question says that it will be roughly 2 days before their computer system recognizes that and allows me to do your Medicare supplement application. And he said, okay, well, that sounds great. And then this morning, I get a message from Cal. Good morning again. I listened to your podcast. And he said, I apologize if I have caused you inconvenience with the state of Nebraska. Here's the pithy part. He said, I understand the difficulties. It can be tough to work with them. He is an expert on Nebraska government, apparently. He said, is this a situation where I should just go purchase from someone else? And I took a little bit of time away from my preparations for this podcast episode, and I said, no, sir, I want to make sure you have the product that you prefer, and I think this is going to be a good learning experience. So I have to do more podcast recording shortly, and I will get back to you ASAP. And that's my intention. He's still got a few months to go before he has to be signed, sealed, and delivered, and I believe that I'm going to learn a lot about how this company operates in the meantime.
Well, it's not so much how the company operates, it's how the state of Nebraska operates.
Well, they caused the original delay because I've got a personal license in every state, And then I've got a corporate license in a bunch of states, but I got tired of paying inflated fees. And so I just never got one for Nebraska. I've never had a company demand that I get a corporate license before they'll allow me to sell any of their products. That seems counterproductive.
Well, let me share just one other little tidbit with you about Nebraska. You may not know this, but the governmental structure in Nebraska is unique in terms of how it's structured and how it works in the entire United States.
Can I dredge up a term I learned when I was a little kid and it stuck with me all these years?
Sure.
Unicameral.
That's it. That's Nebraska.
Oh boy, how did I remember that?
There's only one of them in the United States, and it's in
Yeah.
Nebraska.
Yeah. Well, I'm not sure that the state legislature has an effect on the boneheaded lifers that populate the insurance department. But in any event, and it could be the fault of this company that we're dealing with too. This is my first time selling a product. I contracted with this company a few years ago, and I said, I want to watch how they operate. I want to make sure that I never put a client with this company that is going to have a problem. So I said, I've got plenty of time. I'm going to watch everything about them, their rate increases, their customer service complaints, and all that stuff. And maybe a few years down the road, I'll feel comfortable putting clients with them. So I was starting to feel pretty good about them when along came Cal. Boy, let me say that again. Along came Cal, and he said, okay, I've looked at all the quotes you gave me. I think I want to go with a product from that particular company. And I said, okay, this gives me the opportunity to see them from the inside. You're my first client that I'm going to put with this company. And of course, it's been nothing but problems ever since. I don't know how much of it is caused by the company, how much is caused by the state of Nebraska, but by golly, Cal, I'm going to figure it out, and you will have the product that you asked me for, or I'll die trying. And that's the bottom line there.
All righty. Well, you know something?
I don't know what you're talking about.
We're out of time.
Oh boy, darn it. I had so much more. I've got a big stack of stuff here. I guess it'll have to wait till next time.
We got to talking about headwinds, and obviously we didn't get through the rest of the podcast as quickly as we would have liked because we were facing headwinds.
Well, headwinds and also tiger sharks or what are those animals? Leopard seals. Yeah, I can't wait to hear the end of that story.
After we get done here, I'm going to look up a picture of a leopard seal and I'm going to send it to you.
That's probably going to frighten me.
Bottom line is they absolutely look like something that has risen out of hell.
I'm not sure I'm going to want to see that picture, so maybe I'll show it to somebody else first and see how they like it.
And if they keel over in a dead faint, you'll know. Don't look at the picture.
That's right. That's right. Oh boy.
So anyway, here we go. We need to close up shop here. We certainly don't want to disturb our advertising income because we're coming into the time of the year that we need to spend it for holiday money. But here we go, people. You have just spent about 32 and a half minutes with Doug, but there's a few other things I need to talk to you about first. Write down this email address, dbj@mlmmailbag.com. That's where you can reach out to Doug to ask a question, make a comment, or anything else. Don't forget, Doug is licensed nationwide, and he's trying, even in Nebraska, to be licensed to sell you and help you with your Medicare supplement planning. MEDICAREforthelazyman.com. That's our website. Got a lot of cool stuff going on there. And you're wandering through the wild of the internet. Drop a review for us. It's still good. We're coming in on year end, but I want to finish strong ahead of the people that we're always ahead of, the travelogue people. Last but certainly not least, thank you for joining us today. You could have been anywhere else, doing anything else, and you were with us, which is exactly where we love to have you. And you've just spent about 32 and a half minutes with Doug Jones, the anti-insurance insurance guy, originally from Oklahoma, now living in the nosebleed mountains behind Cave Creek, Arizona. And as you guys that have followed us for a while, I always decide what altitude I'm going to put him in at so he knows how to react for the rest of the day. And I'm going to put him in at 8,500 feet.
I think the way I'm going to react for the rest of the day is to take a nap. But in any event, thank you so much, ladies and gentlemen, for joining us. I hope you had a good time. The time goes so quickly that it's hard to believe that we have passed by, but we will be joining you again, or we'll be presenting another episode very soon, and I sure hope you'll join us for that one. In the meantime, Bye bye.